Good evening, Brooke. How are you doing today?
I'm good. How are you?
Fine, thank you. Thank you for sitting down to talk with us today. So I'll start off by asking you to tell us a little bit about yourself.
Well, first, I'd like to thank you for the opportunity to do this interview with you. My name is Brooke Sparks Espinoza. I am a mother of a 15-month-old sweet little girl named Isabella Grace, who is always on the move, and the wife of Carlos Espinoza. We've been married for about 3 years now, and I am also the owner of Nightingale's Lady LLC. I am a nurse practitioner who does basically house calls to residents who live in facilities such as nursing homes and assisted livings in the Fredericksburg, Virginia area.
Okay, thank you very much. When you talk about nurse practitioner, I know a lot of people have heard about it, but myself included, I don't know what they're supposed to do. What do they do?
So I'm actually a FNP, a family nurse practitioner.
Okay.
So I do everything from cradle to the grave. So I actually do pretty much everything a doctor can do. We can write prescriptions, see patients and diagnose them, order lab work, order physical therapy, occupational therapy, speech therapy, hospice, palliative care. We can even go into specialties, but I've chosen to stick with geriatrics because that's where I started and that's what I love to do. So.
Okay. Thank you very much for that information. So I noticed a little bit of a not confusion, but a lot of people don't know what physician assistant versus nurse practitioner versus a doctor, what the real differences are. So can you enlighten us a little bit?
So doctors go to medical school, have a residency, usually an internship, and usually you'll see them more in the hospital setting, and you'll see them more in specialties, and then sometimes in primary care. Uh, Physical physician's assistants typically go to a different type of schooling. It's not as intense as medical school, but they still go for almost about 4 years. They do an internship during their time in school or residency program, and then they usually go out and work. You'll see them in the hospital too. You'll see some of them in primary care, but a lot of times physician assistants you see in specialties such as gastroenterology. You'll see them in orthopedics. They can do more surgical procedures than like doctors do,
Okay.
more intense things. So you'll see them a lot more in those kind of categories. Nurse practitioners, we kind of fit more in the primary care scheme. So you'll see a lot more of us in practice with physicians in like a primary care setting. There are some nurse practitioners who do specialties such as hematology or oncology, hospice, palliative, but it seems like we're a little bit less diagnostic
Okay.
and more holistic. So we
Okay.
tend to kind of go into the fields that are a little bit more rounded for the patient.
Okay.
You'll see us a lot in nursing home settings and things like that where we have to, do everything patient care wise.
Okay.
Um, there are nurse practitioners who do the hospital, but usually it's under a specialty. It's
Okay.
not necessarily just everybody kind of ends up going somewhere where they're comfortable.
Okay. Okay. So is there any, usually when we see people doctors or even in a lot of fields, they have these acronyms, and you've thrown a lot of terms around palliative, all these things you've said. A lot of people don't know what they mean, but I mean, we'll move on. I think as we speak, you might, touch on some of these things.
Mhm.
Do you have like an acronym, like in front of your name after you?
So I have several.
Yeah.
um, because the state of Virginia requires us to continue as registered nurses,
Okay.
I have RN
Okay.
and then technically BSN,
Okay.
Bachelor's of Science in Nursing, and then I have MSN, Master's of Science in Nursing, and then I have FNP-C for Family Nurse Practitioner certification.
Wow.
But we shorten that to just NP, because if
Okay.
not, I'd never finish writing my name out all
Right.
day.
Right.
So, and I write my name out a lot.
Okay. So great. What's a typical day for you? What did you do? You know.
So there's two different typical days. For a nurse practitioner who is in an office setting, typically you have patients from 8 to 5. You might have like an hour window for lunch. I was in an office setting for my first nurse practitioner job, and that was roughly my schedule. It's a lot of charting, though. Sometimes you try to chart while the patient's there because you want to give them their notes to take home and, review all the meds and everything. But sometimes that doesn't always work out because you might get behind. So you try to get as much done, but you're answering phone calls after hours. You're taking on call, ordering labs, ordering medications, refilling things. You can be there until 6 or 7 at night.
Okay.
So some nights it gets very, very late,
Okay.
or you can come in really early and do it. But office hours can vary a lot.
Okay.
The setting that I'm in now is I go to assisted livings and nursing homes in the area and see patients, and I kind of make up my own schedule. I'm there Monday, Wednesday, Friday. The staff know they can get a hold of me 24 hours a day, 7 days a week. But I go in and I see patients. I do my notes. I order my labs. I order tests, whatever I need to do, medication changes. But then sometimes at home, I still have to do things like fax prescriptions and other things. But I try to do as much work at work.
Okay.
If you're in the hospital setting as a nurse practitioner, typically you work 12-hour days, 7 to 7. And then they do 7 days on, 7 days off.
Oh, wow.
And so that can be very long because you're actually on call until 9 o'clock at night. So 2 hours after you leave, you're still on call. So those can make for some really long days. So you have to be really dedicated to that schedule, and it's weekends and holidays. And the nice thing about being in an office is you don't necessarily work weekends and holidays. We work weekends and holidays because if a patient has an issue, we respond. So every position's a little bit different in what you're looking for.
Okay. So if somebody doesn't know what we are trying to say here is, you basically working your work day is basically like a doctor's,
Basically,
almost like.
yeah.
Okay.
We
I got you.
basically do a lot of what the doctors do in terms of ordering labs, testing, medication changes, patient care, and a lot of it's the same.
Right.
Medicare, I wish Medicare recognized us as our own. The state of Virginia just passed a new legislation that we can actually practice on our own. After 5 years of being a nurse practitioner, we can apply to practice on our own without being with a doctor.
Okay.
So a lot of us that have been out for a while have thought about opening our own practices and maybe doing our own thing. So that's
Okay.
nice that we have that kind of option. But if Medicare doesn't recognize us as our own entity yet,
Right.
that's important for reimbursement because a lot of
Right.
patients have Medicare.
Okay. So I mean, you seem like you like what you do. You love what you do. Did you always think about being this even as a child? Did you look forward to that?
No. I wanted to be a zoologist, and I wanted to study panda bears.
Okay.
I grew up loving panda bears. And then I also thought about being a marine biologist and studying to work with dolphins and manatees. And so, no, this is not exactly what I thought I'd be doing.
Okay. So what would you say are the factors that led you to this path?
So when I was 15, I was running cross country, and I ran and had developed a stress fracture, and I didn't know it. And I ran on it and broke it and broke my leg. About a month later, I started having swelling in my hands and my feet. Horrible swelling, like the size of like cantaloupes. And my primary care saw me and he said, "I think you have rheumatoid arthritis. I'd like to refer you to Children's Hospital." So I went to Children's Hospital and they diagnosed me with rheumatoid arthritis. And I had a doctor that she didn't believe I had rheumatoid arthritis at first, until the lab work came back. And then she was saying I was doing it just to get out of school. I was 15, and that's kind of an odd time to be diagnosed with rheumatoid arthritis, because most kids are diagnosed much younger.
Okay.
But they said it was the stress that had caused me to develop the arthritis. It had, all of a sudden come to the top. And I just remember the doctor, I told her, I want to go to school and study and be a rheumatologist.
Okay.
And she was like, very point in that she said, my arthritis was so advanced, I might not ever get to go to college, and that I'd probably never get married or have children because I was started on chemotherapy at 15 for my arthritis. That used to be methotrexate, which is a chemo drug. In small doses is used to treat rheumatoid arthritis. And so she started me on that. And she was very to the point that, your life might not work out the way you want it. But I never gave up my dream of being a rheumatologist. So I didn't quite get there, but I love doing what I do right now. And that kind of set me on that path.
Okay. Very interesting story.
Yeah.
So the $1,000,000 question, how exactly does a person become an NP?
So I did it the hard way. So you don't want to do it the way I did it. I was actually, I went to school for 4 years to go to PA school.
Okay.
And I didn't have, or physician's assistant school, and I didn't have the requirements to get into the physician's assistant program because I looked at it too late and realized too late that I needed too many classes. And I was getting ready to graduate with my bachelor's of science just my bachelor's of science in biology. So I thought about going to medical school, but we didn't have a medical program at the school I was going to. So that's why I had chosen biology, and then that didn't work, and then the PA school didn't work. So I applied to the local community college and actually went backwards and did my licensed professional nursing, which is an LPN, and which is, if you look at the categories of nursing, you have a certified nursing assistant or CNA, and then you have a licensed practical nurse, which is the next step up. And then you have registered nursing, then you have BSN or Bachelor's of Science in Nursing, and then you have Master's of Science in Nursing, and then that's where you have your nurse practitioners and nurse anesthetists and midwives. And so I was starting at the bottom of the rung. And so I did the 1-year program and got my certificate at the community college, and then I went back and did a transition course and then went into registered nursing at the community college. So my parents say I do everything the hard way, lovingly. So I just took a step back and got my associate's degree, basically. And then I still had to go get my bachelor's of science in nursing after that. So then I went to ODU, and ODU had a very rare program in that it's a second degree program. So everything I had done for my biology degree, chemistry, your basic biologies, your anatomy and physiology transferred. So I only had to do the nursing core classes. So it was 13 credits, which I knocked out in a year and a half. So I graduated with my bachelor's of science from nursing from ODU, and then I just transferred into the master's program. And then from the master's program, there's different types of nurse practitioners or different types of programs you can go into. So then that was basically, I knew I wanted to do family nurse practitioner, so I chose that. But you can go be a nurse midwife and deliver babies, or you can go be a nurse anesthetist and do anesthesiology, or you can go do nursing executive and do administration, or you can be a nurse educator and do teaching at nursing schools and things like that. So there's a lot of different realms once you get to that master's, but they all start out with the same kind of core classes. Anatomy, physiology, pathophys, and then you've got your research and things like that. So a lot of it is just you have to keep going to get there. And it sounds like a long time, and it did take me a long time to get, because I worked full time while I went to school. And some people have the luxury of working part time and going to school part time, and Some people can go to school full time and manage to work full time, but I couldn't do that. So
Okay. It's a lot of information there.
yes,
Uh, while you were talking, you said a couple things. Initially, you said LPN is licensed professional nurse.
licensed practical
Practical.
nurse.
Okay. Thank you for that
Yes, so that's
clarification.
a year. So usually 3 semesters at a community college. It's a certificate
Okay.
program.
Okay.
So if you are starting out and you're just out of school and you're not sure if nursing is really what you want to do and you're kind of like just trying it, if you don't want to do the CNA program, because most CNA programs are like 6 to 8 weeks,
Okay.
then nursing is a little bit longer, but at least you get a certificate when you're done.
All right.
And then you can transfer, it's a 1 semester course, into the registered nursing program at the community college.
Okay.
So you actually only, because the registered nursing at a community college is a 2 year degree, so you're really only losing 1 semester by going that route.
Okay. Okay.
So, I mean, it's not that big of a deal to give up 1 semester.
Okay.
If you really are just trying to get in and kind of go, then that's not a bad way to going. Now there are different schools. There are technical schools, like you can go to a technical school that does LPN or RN, and those programs vary on how long they are, and they don't always have the prerequisites that the community college does, such as anatomy and physiology. They kind of teach their own version of it that's more condensed.
Okay.
You don't have the chemistry, you don't always have all the biology. So when you try to go to like a bachelor's program or a master's program, you might have to go back and take those core classes. So sometimes you have to look at what your end goal is. Like if you're like, okay, I'm just going to get to registered nursing and I'm going to stop, then it might be worth it to go to a trade school or a technical school. Sometimes they're more expensive because everything's condensed and you're going to get through and then you're done. Sometimes the timing's better.
Okay.
You know, they're shorter programs because you don't have to take all those other prerequisites. So it kind of really depends on what your schedule looks like. And do you have a family? Do you have work? Do you have other, commitments that are going to keep you from going to school?
Okay. Thank you. That was my next question, but I think you knocked it out together. So that's good.
So a bachelor's program is 4 years.
Okay.
The because I was a second degree, mine was 2.5.
Okay.
So, and typically you can actually go, there are some universities or colleges that offer a 4 year RN and BSN combined. Or you can transfer in with your RN and then get your BSN in 2 years. So there's a lot of variety out there, and you really just got to do your research. And, the biggest thing for most people is what schools are here around me? What does tuition look like?
Exactly.
What's the course load look like, and what are the prerequisites that I need, and do I have time to do all this and commit to school? So I think that's the biggest thing, is it's a lot of time commitment, especially if you're going to get to a master's.
That said, you answered my questions again. I was going to ask about schooling, tuition, but
Sorry.
I think that's fine. I think with what you said is good information, because if you talked about nursing route, you talked about LPN route, RN route, and if those kind of information are not hard to find. I mean, how much nursing school cost or whatever, it's not hard to find. But what is hard to find is how to go through it. You don't often hear people talk about their journey. And that's why I'm glad that you're sitting here with us. But I mean, to find out how much nursing school costs, that is not hard to find. So
Like I remember for my BSN program, it was like $340 a credit, which doesn't sound like a lot. But then that's another thing too. If you go to like a community college in Virginia, this doesn't pertain to every state, but community college in Virginia, you can transfer your 2 year to your 4 year and go to pretty much any school in Virginia accepts a degree from a community college. So you can knock out a lot of your credits before you even start paying the higher tuition of higher education.
Exactly. Great information there. Thank you very much.
Sorry to steal your thunder.
No, I mean, it's great. I mean, instead of me asking you, or just you said you gave us the important information to knock everything out. I am one.
It's kind of difficult to break it into pieces because it kind of flows all together,
Hmm.
you know.
Okay.
So.
So anything interesting about school or college for you that maybe made you want to drop out or made you want to go harder? Like anything?
So you always have that one teacher that encourages you and makes you want to really go for it. And then you usually have that one teacher that you just really don't like and who wants to make your life hard. And I had that one teacher who told me I was the LPN to RN transition, and I was fortunate to be in her class. But she basically told me that I couldn't be a nurse, even though I was already a licensed practical nurse. She told me I couldn't be an RN or registered nurse because I have rheumatoid arthritis and I might drop a patient or, you know, I might hurt myself or all these other things. And I had to go to the ADA or committee, Americans with Disabilities, and basically have the counselor's office talk to her about that. That, you know, you can't really say that she can't be a nurse. And so now I would like her to know that I'm a nurse practitioner. And not only am I a nurse practitioner, but I'm also a medical examiner for the state of Virginia. Right. So, you know, you can tell your students whatever you want to say, but, you know, we usually can prove you wrong. And
that's a good point.
You know, I had the doctor tell me that I would never go to college and have kids and get married and, you know, look at me now. And then, you know, this instructor, and I always feel like that's the big thing too, is you have to just keep, you know, put your nose to the grindstone and keep moving forward. So, and don't let people's opinions get you down.
Exactly. Thank you for that. Talking about opinions, in your opinion, what are the rewards, both financially and maybe non-financially? What would you say?
Well, I would say financially, I mean, I'm a little bit different. I'm a private contractor, so a typical nurse practitioner in the state of Virginia starts out about $90,000 a year. Or if you kind of want to look at it in terms of how much an hour, it's roughly $50 an hour. I do things a little differently because I'm a contractor, so the doctor and I have a different kind of way of doing pay, and I get paid once a month, and it's based on visits and blah, blah, blah. So mine's a little bit different. So, but that's roughly what it is. But to me, it's emotionally rewarding because I like to get out and talk to people, and I like to take care of my cute little old people, as I, you know, call my patients to my family. And it's really nice to get involved with their families and with them and get to know their history. And, you know, like we had a patient who has been married for almost 70 years to her husband. And, you know, they met and fell in love and were married in 3 days, and just things like that. And like all the obstacles they've overcome and the wars they fought through and the things they've seen and they've done. And, you know, talking to them about, you know, us landing on the moon and now we're going to Mars. And it's just amazing to see all the things that, you know, we've come along with. And, you know, from their standpoint too, like cell phones, you know, they always are asking me how to fix their cell phones and their TVs and things like that, because they don't know. You know, they try really hard. But it's interesting to see how far we've come and to learn from people who have already experienced life. And they all have good, I mean, I always ask them, like, what's the secret to a happy marriage? And I've gotten all kinds of answers over the years. And it's always cute to get a different answer. But she's always right is one of my favorite ones.
So me too. I've heard that a lot of times.
She's always right.
I love that. Yes. Yes. So I was going to ask you, like I said, you keep answering all my questions. I was going to ask you about a new graduate versus a seasoned, you know, NP, what the salary, you know, range is. But I think you have a fair idea. Usually people care about the new.
Yeah, a new grad is probably going to make about 90. I mean, I've seen new grads make 120. So, I mean, it just depends on where you're at and what, value you bring to the practice. It also depends on how many, because we're already nurses, we're already registered nurses. We bring a lot of experience. Like I was a LPN, an RN at the hospital, and I was the charge nurse for the renal and respiratory floor and also the stroke floor. So I brought a whole caveat of experiences, how to use ventilators and, how to take care of patients with sleep apnea and seizures and all these different things that I had seen and done, and, ICU training and cardiac training that I had done that I brought with me. And so I think it really depends too on what your past experience is and what you're bringing to the practice.
Okay.
Really, kind of shows what you're going to get paid.
Okay. So what's the job prospect and job security like?
So I think it was 2015, there was a study that the U.S. was about 100,000 primary care providers behind.
Oh, wow.
And by 2030, I think that number will double. So this study was looking at putting nurse practitioners in the role of primary care providers, which is one of the reasons the state of Virginia has been moving forward with giving us our own autonomy.
Okay.
And I really think that we fill a gap that really is needed. Nursing has always been short. We're always short nurses, and now with the virus and everything going on, we're even shorter on nursing. But I feel like we're also short on physicians. You can only have a physician treat so many patients, and they're done. They're mentally, you can't handle but such a big load. So I think that's the important part, is we fill a gap that's needed.
Okay.
And physician's assistants are, they can fill that gap too, but they're going to be more in specialties than I think most nurse practitioners are.
Okay.
So I see the schools picking up the amount of enrollees and picking up. The other part of that is a lot of the hospitals, in order to have magnet status, which means that they get more reimbursement from insurance and Medicare, they have to have the magnet status is based on how many of their nurses have their BSN.
Oh, wow.
So if you're going to go and get your BSN, you might as well go 2.5 more years and get your nurse practitioner. To be honest, the nurse practitioner program is only 1.5 years.
Oh, okay.
If you do it full time. Part time, it's 2.5 years. So, I mean, what's another 1.5 years after you've already struggled through all these other courses? So, I mean, it just kind of depends on what you're looking at. But I think we're going to fill that gap of primary care.
So you encourage people to get into it?
Yes, definitely.
Okay.
I think
Perfect.
I always encourage nurses to keep going, no matter where they are.
Right. So, as you said, keep going. I'm going to use your words today. What are some of the challenges as you go up? Are there any, or does it get easier? Like, what would you say? As you're already in the job.
What are the challenges? So, I mean, right now we have a very unique challenge, which is a pandemic, but I'll save that for later. But I think a lot of it is there's so many different ways. Like, I have friends that are nurse practitioners that go see patients in their homes, and then I have ones that are like me that go see patients in facilities, and ones that work in the hospital, and ones that work in primary care, and ones that work in doctor's offices, and ones that work in specialty offices. And I think it's just, there's so much variety that I think it just makes it a very dynamic profession right now. And I really think that the challenges are how you kind of fit all of those into, you can't fit it into a category. So I think it's a lot of, focused, and I think the state of Virginia is slowly coming around to that we're going to fill in all those gaps that are there. So daily challenges would be prescription costs. Medications are, the healthcare reforms don't really help, because medications are still expensive. You have to fight with insurance companies to get what the patient needs, and you're like, but this is what is the standard of care, and they're like, well, we don't want to pay for it. And so a lot of prior authorizations, a lot of almost trying to find the loophole to kind of get the patient the therapy they need or the medications they need, or trying to figure out different avenues to get the outcome that the patient needs. So I think a lot of it is the insurances battle us so bad right now.
Okay. Since you've gone through the long route, I know that some people go to school for exactly that, to be an NP, right? So what is the expectation versus the reality in the field? You know, what would you say?
So I think you get to see the reality a lot while you're doing your clinical. We had to do like 600 and I want to say it was 660 hours. Don't quote me on that, but of clinical time. So I think you see the reality of scheduling in an office and patients being late and providers, running behind. And I think you see a lot of the reality. But what I don't think you see is the billing frustrations of things not getting paid on time, or insurance companies battling you for medications and procedures and things like that. So I think that is always like eye-opening, that you could have somebody who's never seen the patient tell you that they don't need this. They are never going to see that patient. Right. They have never laid eyes on them. And then the other thing is I get a lot of stuff saying my patients are non-compliant with their medications and they've been deceased for 4 months. So I feel like the insurance companies don't keep up with what's actually going on with the patient, but then you try to order something and then they want to be all in your business. So I feel like the insurance companies really fight us and don't really, have the patient's best interest in heart. And I think every nurse practitioner across the board would probably agree with me in some form or fashion.
You mentioned something that took my mind back to something I meant to ask you. When you finish, when you complete the schooling, do you just get into the field and work? What do you have to do?
So you have a lot of steps, and nobody ever tells you. I always have, so I precept students that are nurse practitioner students for various schools. I've done some for Walden. I've done some for George Washington University. Actually, several for George Washington University. But I always sit down with them as soon as we're finished with clinicals, and I say, this is the stuff that nobody tells you. Like, these are the books you want to study for boards, and these are, this is step A through Z on how you get credentialed. And nobody ever brings up that word until you're done with school. And then they're like, go get your credentialing done. And that's like, what is that? And so we have to take a national board. So you sit for boards. You find out right then whether or not you pass. So it's the most agonizing 3 minutes of your life. But when it pops up and says you passed, you just dance out of the room. So, and then you go to Starbucks and get a large Frappuccino to celebrate your long ride home and your excitement. But you have to contact the state of Virginia and send them your application, because you have to get a license through them, and you have to have an RN license within good standing. So you have to wait a couple days for that, and then you have to apply to get a prescription license to have the right to prescribe medications in Virginia. So then once you get that done, you have to turn around and apply for a National Provider Index, or NPI number. And that's like your social security number for your medical practice for the rest of your life. And so once you get that, and you have all that together, you need to get malpractice insurance, which is about $1,000, if not more. So you need to find a company that will...
Per month or what?
No, it's per year, but it's still a lot of money. But up front, when you haven't even started working yet, you haven't done anything. You're just... So most doctors will help you pay that to get started. Not all, but most. So, and then once you get your malpractice insurance, you can actually go online and apply for Medicare and Medicaid, because you want to be a provider for Medicare and Medicaid, since most patients have Medicare. And in the nursing home, you see a lot of Medicaid patients too. But and then, if you do like pediatrics, various entities, primary care, you might see some Medicaid patients. But you have to go online, and their applications are horrendous. They take hours to fill out. There's actually people that run companies that's all they do is credentialing for you. And if your doctor's really nice that you're going to work for, he will pay somebody to do it for you. If not, you get to do it all yourself. And it's very difficult because if you mess up, they reject it and you got to start all over again.
Oh my gosh.
And Medicaid is a pain. So, because it got rejected. So, and then once you get all that done, you actually have to go to another website, which is CAQH. And for the life of me, I can't think of what that stands for right now. But what that website does is all the other insurance companies, Humana, Aetna, Blue Cross Blue Shield, the VA, everybody else who might have some kind of anything to do with insurance payments, they get your information from that website and to make sure they have the most up-to-date information on you. And they can access your licensure, they can access your malpractice insurance and everything else. And basically that's how your payments are, they know how to submit your payments. So when you bill, you get paid. So, which is, always nice when the doctor you work for gets paid for the first time, because they're always so excited because they get this big check. Because it takes sometimes as long as 90 days to get everything set up in the computer before you start getting paid. So you'll see patients and they'll pay you, but they might not get paid until a couple weeks down the road. So, but yeah, it's a lot of work that nobody ever tells you about. And then you still have to interview for a job. If you've gotten all through all that and you still haven't found a job, you still have to interview. So it's a very long, drawn out process. And then too, if you want to prescribe narcotics in the state of Virginia, you have to have a DEA license. So you have to apply for that too. And that's good for 3 years, and it's about $800.
Wow.
So you're paying all that out of pocket. Because, the licensures for the state of Virginia, you're still paying for too. Wow. On top of taking your test and everything else.
See, this is quality information that nobody ever tells you.
So it's probably a good $2,500 from your test to being done.
Wow.
So it's
great information here. Thank you
long
very
drawn
much.
out process there.
Thank you very much for the information. So we're getting to the end of it. Thank you very much. How do you think being a nurse practitioner has shaped your life, or has it in any way?
I feel like I've learned a lot about living by being a nurse practitioner. I have a lot of respect for, the trials that everyone goes through and how hard life is for some people and how easy it seems for others. But I think a lot of it is you learn to value your time. And I was told one time by another nurse practitioner, you either have time or money, not both. And when I first became a nurse practitioner, I was focused on the money and not the time. And now that I've been doing this for 6 years, I focus on the time and not necessarily the money. I believe it's important to have quality time with your family and spend time with your loved ones, because you never know when our last day might be. And I think a lot of what I do focuses on death and dying between the medical examiner role and the nurse practitioner role and my geriatric patients and hospice and palliative. So I think you really have to learn to prioritize what's important to you. And I think my daughter and my husband are my priority, and my family is my priority, but my patients are right up there. I each one of them is like a family member to me, and I love them like my grandmother and grandfather. So, but I think you really do have to, you learn that all the schooling in the world, is not as important as your family. Exactly. And you really have to, make sure you're there. Okay. So it's not always about the financial, even at the end of the day.
Right. I know you've had a long journey to get to where you are, and it sounds like a great journey so far. But do you wish you had done anything differently?
I wish I hadn't gone to get I wish I'd done the research at the very beginning. and gone straight into the RN program. And that would have probably sliced a good 6 years off the process.
Wow.
Um, so I started going to school in 2000, and I graduated with my MSN in 2014.
Wow.
So, a 14-year journey where I could have cut off 6 years would have made a big difference. But I mean, I guess that's why I'm here, is I get to tell people that's what you should have done. That's what you should do,
Right,
having made the mistakes myself. I mean, we all learn from our mistakes. So, I mean, I focus on my daughter and the fact that when she's ready to go to school, I'm going to be like, is this really what you want? But I have my cousin's daughter came to stay with us for a week. And she actually went to work with me a couple days at the nurse practitioner job to see, because she wanted to be a nurse, but she wasn't sure she wanted to be a nurse. So my cousin sent her down here and was like, you take her to work and make sure this is what she wants to be before she goes to school. So I was like, okay, good, because I don't want her to make the same mistake I did, So she decided she didn't want to be a nurse after a week with me. And I was like, okay. And I was like, I wonder what I did wrong. And because usually, my students just love it. But so she started school, got through the first year, and then she applied for the nursing program. Because the more she thought about it, the more she decided she wanted to be a nurse. So I feel like you need to have that experience. And I wish we had preceptor programs like that for students that are thinking about doing that. So that they could come in, like especially high school students where they're not really sure, I mean, most people aren't aware that nurses actually have to clean patients up. We all call it a code brown for a reason. And, once you do that and you learn that and you get that down and comfortable, the rest of nursing is great. Yes, you have to go clean patients up. But, I mean, it's just an experience that I think everybody should have too. And it kind of prepares you too for motherhood and, being a parent too. Smaller versions. But I mean, I feel like you should really get that experience. And I wish we had more open availability to do that with kids and give them that direction. So I think actually any field you want to go into, you should be able to precept and see if that's really what you want to go into long before you go into it.
Exactly. I mean, I know this is not exactly it, but this is one of the motivations for me for starting, something like this, to kind of have, people that are in the field, have experience in the field, to be able to talk about their personal, journey, that so that other people can also learn and really know what it's about before they get in there, as opposed to going on the internet and trying to find generic information about how to become this or that.
And there's a lot of differences from state to state. So I keep saying Virginia because Virginia has different regulations. So every state's a little bit different. So you have to kind of really delve into what your state requirements are. The nice thing about Virginia, though, we're a compact state, so there's about 25, might be up to 30 now, states where your license can transfer to that state, no problem. So you don't have to go retake your boards, you don't have to go retake classes or anything like that, which is awesome. And it would be nice if the whole U.S. was that way. Like all 50 states, you could take your license and move. It's especially important for military families, but it would be nice if the rest of us could move too and just take our license with us, especially if you're in good standing, because God knows we need nurses now more than ever.
Yeah. Thank you. In this times that we're in, with the COVID-19 pandemic, in general and also personally, how has it, changed practice, or how has it affected the field?
I've never felt so helpless as a provider as I have with this going on. Because in the part of the chain that I'm in, going into facilities, there's very little I can do. I mean, I put my patients on vitamin D and multivitamins and zinc, and I tried to, make sure we push fluids. And when we did have our outbreak, I've lost 5 patients to it, which I feel is one was a waste. All of them were a waste. But, any time you lose a life, you feel like, what could I have done better?
Mm-hmm.
What could I have done differently? I always sit back and look at that and, think, did I make the right decisions for this patient? Did I make the right decisions with the family?
Mm-hmm.
So I think a lot of it is we've never seen anything like this. I keep telling patients' families, I know they're tired of probably hearing that, this is an unprecedented time in healthcare. And it really is, because nobody thinks I'm going to go into healthcare and I'm going to have to work through a pandemic, let alone live through a pandemic.
Mm-hmm.
So I think a lot of it is our fact that we don't know enough.
Mm-hmm.
We kind of got up there and made it sound like we knew more than what we did.
Mm-hmm.
And we probably should have just said, we're going to let you know as we know it.
Mm-hmm.
But, hindsight's always 2020. So I feel like it's been a lot of learning for everyone, but just not being able to do anything other than push fluids and give vitamins. Because, I couldn't even order steroids. We had a patient who needed the dexamethasone for another issue, not related to COVID. And we couldn't even order it because it was on back order and the hospital was getting priority, as they should. So we had to be creative because steroids were hard to get for a long time. So it's things like that. You never really understand how things are going to change until they change. Or ordering PPE, or making sure we have enough of our own stuff. I had to buy stuff off of Amazon and not my medical supply company, because my medical supply company was, holding it for the hospital, as they should. So I think a lot of it was learning how to adapt.
Mm-hmm.
And nursing is all about adapting. But we've never seen anything like it. And then not being able to do anything. I can't even give IVs in my environment because we're not licensed for it. So even if they got dehydrated, I had to send them to the hospital. If they quit eating, they needed a feeding tube, or their kidneys started shutting down. There was nothing I could do. And the nurses and I felt helpless. And I think I can speak for all of them when I said, we never thought we'd be doing these kinds of things. So I think it's been a very unusual time for all of us. And I think a lot of people are getting out of healthcare because of it too.
Wow.
Because they don't like where it's heading. The telemedicine is very, very new and evolving. And my husband asked me, why are you going in to see patients? Can't you do telemedicine? And I'm like, first of all, I can't assess a patient's lungs or their heart rhythm, or check their neuro status, or even, touch their skin just to see how, their skin is doing. I'm a very visual person, but I'm like, that's not, I didn't learn that in school, how to assess somebody over a video camera. I learned how to assess a patient in person. So for me, it was a very easy decision. You just put everything on and you go to work.
Right.
And, but I don't know where healthcare is going to go from here, because a lot of doctors like that for stable patients. So I don't know if we're going to see a transition for primary care providers and nursing home patients, that they'll do more telemed visits and you'll see less of the provider. So it's hard to know, but I never thought I'd, have to worry about doing online visits, but it is what it is at this point. But it's nothing. It's just an unusual circumstance right now. And hopefully the vaccine will pull us out of this. But even then, people are leery of the vaccine because it hasn't been tested enough. And, we don't usually typically push medication through the FDA that fast. So it's going to be interesting to see the next year what happens.
We're coming to the end of this, and but finally, I have to ask you. I have to do this for people that are watching. What advice would you have as you've gone through it for a person, maybe a youngster, like you mentioned, you said your cousin's daughter that came here. People like her. people that are coming right out of high school, even people that are just going into college, or even somebody that had done something else and trying to go into a different field, perhaps an adult? What kind of advice or what advice would you have for them if they're looking at being a nurse practitioner?
Well, I would definitely say make sure it's what you want. I mean, some people are good at stopping at registered nursing or getting their bachelor's and stopping, but it's very time consuming, the job, because, like I said, I'm on call 24 hours a day, 7 days a week. So I don't really get time off. When my husband and I travel, I have to ask the doctor to cover for me, which is fine. But I mean, it's you get really involved with your patients,
Mm-hmm.
and it's almost like they become a part of your life too. So, and the families become a part of your life. And that's not true for every doctor's office and
Mm-hmm.
across
Mm-hmm.
Virginia, but for me, that's how it feels. So I think the thing is you have to be a people person,
Mm-hmm.
and you have to make sure this is what you want. And you have to make sure you have the time and that you're able to just still devote time to your family
Mm-hmm.
and time to yourself to do your self-care, and
Mm-hmm.
then, which I am horrible at, and then you still have to have time to take care of your patients. So I feel like you have to be really good at time management. You have to know when to say no.
Mm-hmm.
But I feel like you always have to keep moving forward.
Okay.
That's Walt Disney. Keep moving forward. I'm a big Disney fan, but so you always have to keep pushing, and whether it's continuing education once you're done, which we have to do 100 hours of CEUs in 5 years. So
Okay.
if
Okay.
you started when I said 100 hours, he like freaked out. So, but over 5 years, so it's not as bad. But you really have to think about what you want to do and what you want to accomplish, and you have to just really keep focused
Mm-hmm.
and keep moving towards that goal.
Okay.
If I had let those people, the doctor and my professor, tell me that I couldn't
Mm-hmm.
do it, and if
Mm-hmm.
I'd have just rolled over, I would have never gotten where I
Right.
am today.
Right.
And you just have to like
Okay.
do it.
Okay. I meant to stop here, but you said something that brought another question to me. You said 100 hours in 5 years. So is it, do you renew your license every 5 years?
We do
Or
renew. So because ours is a national certification, we renew ours every 5 years. Now your nursing license and your nurse practitioner license through the state of Virginia is still every two, and your prescriptive authority is every two. So you have to pay those every 2 years.
Mhm.
They're going to ask you if you did your CEUs,
Okay.
which you're supposed to be working on them, so you can prove that.
Mm-hmm.
So they have a way of checking to see if you've been doing them. But you can not do the CEUs, and you can decide to retake your boards, which I've had people do that, friends of
Wow.
mine, and they're like, I don't know why I did that. I should just done my CEUs. But and um, a lot of our conferences
Mm-hmm. Count.
count for
Okay.
that. I get magazines of journal articles all the time. You can go onto websites and pay to do the CEUs through them, and they send you the certificates. It's not that time consuming if you
Okay.
think about it. A lot of it is journal articles and
Mm-hmm.
research articles that you're
Okay.
reading,
Okay.
and just keeping up to date on new medications and changes in the world, such as
Okay.
a lot of them have been COVID focused, go
Right.
figure,
Right.
right, lately.
Mm-hmm.
So, but new treatments for diabetes, and new treatments for hypertension, and things you need to look for, and
Okay.
disease processes all go together.
Okay.
So it's like how everything is intertwined.
Okay.
A lot of our research studies focus on that.
Okay. So the licensure for nurse and nurse practitioner is 2 years, but the CEUs should be 5 years.
Should be 5 years, and your national certification. So I'm an A ANP, so American Academy of Nurse Practitioners.
Mm-hmm.
So I am a 5 year. The ANCC, which is the American Nurse Credentialing Council, I think. I see. I should have looked that up before you came. Theirs is 5 years too. So both
Okay.
of them are the same.
Okay.
They're one of two entities that can certify a nurse practitioner. I have had friends who have taken both boards.
Oh,
I'm like, no, I'm good taking one
wow.
and passing. I was good with that. But yeah, it's a little bit different credentialing and a little bit different licensure, but ultimately the same thing. You're still a family nurse practitioner either
Okay.
way.
It's actually
Or you can focus on American.
American Nurses Credentialing Center.
So I almost had it right. American Nurses.
Credentialing
Yeah.
Center as opposed to council.
Council. Yeah.
Right.
I almost had it right. So the interesting part that I was going to bring up after that was now you made me lose my train of thought.
Well, as you think about it, I was, I think when you mentioned the CUs, you said 100 hours every 5 years. I
Mm-hmm.
also wanted to ask, do you have a working hour requirement? Do you have to have worked a certain number of hours to be able to renew your
So it's
license?
1,000 hours over 5 years, which is like nothing.
Oh, for work.
Yeah, for
Okay.
work.
That's
So and that's assessing, diagnosing, and treating patients. You have to fit those three criteria.
Mhm.
So there are nurse practitioner jobs that involve like going and just doing health assessments on patients, but you don't actually diagnose or treat them. So
Okay.
that one would not count towards your renewal
Okay.
of your licensure. So you have to kind of watch jobs like that too, because there's some. I saw one the other day. It was doing visits for the VA, and you were just going to do health assessments, but no diagnosing, no treating.
Okay.
And I'm like, oh, that's not a job that you could use for recertification. So that would not be what I would consider a very good job
Right.
for somebody who was looking to renew. And then some nurse practitioners, they've been doing it for 50 plus years, and they keep every 5 years you have to renew. So
Okay.
that's not as bad as the registered nursing every 2 years.
Well, thank you very, very, very much for all this great information that you shared with us. I'm sure somebody is going to be ecstatic to see it and to listen to it and to learn from it to, help with their journey. So thank you very much.
You're welcome. Thank you for having me,
No
and
problem.
it was wonderful talking to you.
Thank you.
Most people don't actually ask any of the questions that you ask, so it's good to finally have them out there.
Thank you very much, Dan.
You're welcome.
All right.